talking about. Human energy. We are all bioelectrical, chemical entities. And may I ask, please, may I have both of you, may I ask you to assist? I'll just have you both stand up. Please, a round of applause for our colleagues. And our first levitation act of the day. Okay, thank you. I'm going to ask, please, if you'll take your left hand and just grab around there with your left hand. I'm going to ask you to take your right hand and do the same around that. Perfect. Now, if you both will take the index finger from your left hand and your right hand and just touch them together, what you will notice, yes, don't worry, it won't shock you. You guys can see the energy that's circulating, lighting that up. And now if you remove your fingers, maybe we have two more people come down who are comfortable doing it, because I want to show you that this energy magnifies when we come together as a team. May I ask you each to touch index fingers and then touch your index fingers. And I want to thank you all. Please, a round of applause for everyone. Thank you. We could take the whole class and ring the room, and that energy would be magnified, because all of us have within us energy. Now, this is an experiment. We'll see how this does. A bottle of water, which, as we know, is so important to sustain life. A block of wood was once a living organism, a tree. Now it's desiccated. What does that mean? No water. So this piece of lumber is inanimate. Together today, we are going to, I hope, animate this piece of wood. I'm going to ask you all in just a moment to concentrate on the water, to excite the molecules in the water, so that maybe, just maybe, they'll pass some energy back to that piece of wood and cause it to actually move. Let's see if we can do that. Take the piece of wood, we'll balance it here against the bottle of water. And I don't want you to give yourselves a headache, but I want you to focus your energy on that bottle of water and see if we can animate the molecules enough to bring life back to that piece of wood long enough for it to move. Now let's see, we're all putting our energy there, hoping to excite it, hoping to make it happen. Now this is an experiment. The reason it's an experiment is because we may not get the result we want. So we're hoping that that excitation, you did a great job. Please, a round of applause for yourselves for activating that piece of wood with the water. That's good energy, positive energy that we give to our patients every time we see our patients. Negative energy. We all have that too, unfortunately. We'll put the cup right in the center. We'll cover it. Now I want you all, please, to take the negative energy within yourselves. You may say, I don't have negative energy. The fear, the anger, the frustration, the sadness. And I want you, please, to place that energy. I want you to push it from your mind into this enclosed space. Because hopefully we will fill that plastic space with enough negative energy that we will be able to see something happen. This is negative energy. This is the same kind of energy that happens in a traumatic brain injury when neurons are damaged, when cells die. And you see, there you go, that negative energy, it causes negative things to happen, bad things to happen. Psychotherapy. Psychotherapy incredibly effective, yet again, not without pain. Now I'm going to ask in a minute if I may have one of our colleagues come forward. I promise no stress and no injury to anyone, hopefully not myself, because what we are going to do have a spike, a heavy metal spike. And I'm going to ask, if you will, please gently touch the tip of that spike to verify it is sharp. Yes, sir. I'll ask you please to test gently, because it will pierce human flesh. And please, if you'll verify, it's heavy.
Heavy? Yeah, heavier than I expected.
Yes, yes. Now, may I ask for your kind assistance? We are going to take the spike. I'm just going to set it there. But in a minute, I am going to ask our colleague, if you will, to, and you may do this however you want. You may cover these and then move them all around. Or if you want, you may just take the spike and move it to wherever you want it. However, once you have done so and completed it, I'm going to ask you please to space these out in a nice row. Have them all covered. I will not be watching.
Okay.
I will not know under which cup the spike resides. I will ask you please to keep the spike under one of the cups. And yes, thank you. And when you are done, just say, Dave, I'm ready.
Okay.
Okay, thank you. So I will come forward. Psychotherapy. It can be intense. There are different forms of psychotherapy. When we talk about personality disorders, when we talk about borderline personality disorder, the form of psychotherapy, this is always a board question or a shelf exam question. Remember, for borderline personality disorder, it is dialectical behavior therapy, DBT.
I'm ready.
Okay, great, great. Thank you. Please, you may return to your seat. A round of applause. Thank you. The energy. You held that in your hand for a moment when I asked you if you felt it to be very heavy. And you said, yes, it's heavier than I thought. And you infused energy into that when you did that. That was the reason I asked you to hold it. And so I am feeling for energy. And you see, when we perform psychotherapy, what we're doing is we are getting into the inner psyche of the patient. We are asking the patient questions, seeking answers from the patient. So that they can start to take what is unconscious and bring it up to the conscious. It can be very painful for patients, especially if we're doing something such as eye movement desensitization, reprocessing. Patients can become incredibly emotional. When we engage in the use of hypnosis, we can see what's known as abreaction. It's commonly called an abnormal reaction, yet it's not abnormal at all. It's the absolute release of emotion. Our goal is to bring the patient back to a level of homeostasis emotionally so that they are able to return to a normal life and feel better without us impaling them on the issues that are bothering them. One last visual demonstration. Dreams, the royal road to the unconscious. I'm going to ask, is there any amongst us here today who has a comfort level with playing cards? Doesn't mean it's the product of a misspent youth. Doesn't mean you spent way too many hours playing poker. Anyone here comfortable with a deck of cards knows one card from the other? Thank you, I appreciate it. In a moment, I am going to throw you a box of cards. And I'm going to ask you to catch it. And then I'm going to ask you, please, to open the box and remove the deck. And then I'll have you hand the box to your colleague to your left. And then I'm going to ask you to go through the cards and find a card that you like. Now, please, not a joker, but I want you to find a card that you like. And once you've found it, I'm going to ask you to remove that card, turn the deck face up, put your card in face down, cut the cards a couple of times, and then put the cards back in the box. You'll have to give it back to them when the time comes. Then I'll ask you please to close the box, that's critical, and then throw the box back to me. Okay? Are you ready? Because now I'm going to throw the box to you. Good catch. And now, if you will, I want you to open the box, please. Very good. And then hand the box to your colleague. Now I'm going to ask you to go through the cards. And I want you to find a card that you like. Don't show it to me, please don't. But I want you to find a card that you like. And once you've found the card that you like, I want you again to take the deck, square it up, turn it face up toward the ceiling, put your card in face down, cut the cards several times to change the order of the deck, and then I want you to borrow back the box. Please put the cards back into the box, and then please close the box. Otherwise, we'll be playing 52-card pickup. And then I'll have you throw the box to me. Good throw. Thank you. 3 o'clock this morning, I awoke from a sound sleep. I was dreaming. And in that dream, I dreamt that we were going to be doing this here today. And I got up at 3 o'clock and picked up this deck of cards. I opened the box, I took out the deck, I looked through it, and I thought, this is the card that's going to be selected. I took it out, I turned the deck face up, I put that card in face down, I cut the deck a couple of times, and I put the deck back in the box. And there it has resided since 3:03 this morning. Now let's see if dreams truly are the royal road to the unconscious. Let's see if dreams actually can predict the future. Would you please share out loud with us the actual playing card you selected? It was the Eight of Clubs. And first of all, I really appreciate your assistance. The Eight of Clubs. No fast or sudden moves. As I open the box and remove the cards. We are going to go through, we are looking for one, and only one face down card. And let's look and see if we can find a single face down card. And lo and behold, there is one and only one face down card. Now, what was the card you thought of again?
Eight of Clubs.
The Eight of Clubs. Without showing the face, may I ask you to remove that card, keeping it face down. One and only one face down card in this deck that I removed from the deck at 3 o'clock this morning and put it back in. Wouldn't it be amazing if, in fact, my dream predicted the exact card you were going to select? And if we did, please get excited, because this is a big deal. You were talking about the Eight of Clubs. How did we do? Okay, thank you. Please, we'll take a break now. Thank you all very, very much. Thanks for everyone who assisted, and thank you.